Welcome to the Purr Podcast, your favorite feline-focused podcast, where we dive into all things feline, medicine, surgery, behavior, and of course, a sprinkle of veterinary gossip along the way.
I'm Dr. Yola Krippenstein, feline fanatic, surgery nerd, and self-proclaimed lover of all things awkwardly cat-related.
And I'm Dr. Susan Little, proud cat vet, podcast enthusiast, and your guide to the wonderfully weird world of feline medicine. Let's get started.
Hi, this is Dr. Susan Little.
And this is Dr. Kelly St. Denis, trying to decide who's starting the intro today.
Yeah, I mean, it's kind of hard when neither of us knows what to do.
We don't have Yola here today.
No, we don't have Yola here to keep us on track, right? And although I have to say, we're at the American Association of Feline Practitioners meeting, and we're recording some podcasts, and Yola isn't here, so we miss you, Yola.
We miss you.
Well, we miss you a little bit, anyway.
Like you're having fun on the other side of the world.
Yeah. But it gives Kelly and I the opportunity to co-host together, which we've never done. You've always guest hosted with Yola.
Yes.
Yeah.
This is the first.
So this is us, and anything could happen. Yeah.
Anything.
Anything could happen. So we're very fortunate to have a guest with us today who's new. We've never had you on our podcast, so I'm going to ask you to introduce yourself.
Thank you. I'm very excited to be here today, especially at a feline conference. I am Dr. Sandra Koch. I practice veterinary dermatology, and I teach at the University of Minnesota.
So you teach, so we're in Minneapolis for those who are wondering, and so you teach at the vet school here?
Yes, which is located in St. Paul.
Right.
And I'm originally actually from Brazil, therefore my accent, if you're wondering. I've been here though for 20 plus years now.
Oh goodness, okay.
I came from Brazil to pursue my dream of becoming a dermatologist.
Wow.
And to live in a different culture, to live in the United States.
Yeah.
So
I was going to ask you, like, how or what the circumstances were that brought you. So you came to do a residency, was it?
I came to do my master's.
Your master's.
And then that led me to my residency, and then led me to stay as a faculty.
Wow.
Right after my residency.
So where did you do the master's?
At the University of Minnesota too.
Okay, and the residency?
Yes.
Okay.
With a lovely dermatologist that retired recently, Dr. Sheila Torres.
Oh, yes.
She happens coincidentally to also be from Brazil, and she took me under her wings.
Oh,
and
nice.
My forever mentor, right?
It's so nice when that happens.
Yes, yes. And so now I am trying to take over her shoes into a very busy clinical practice and teaching practice.
Are you the only dermatologist?
Right now, yes.
Yeah.
However, in practice, we just hired a new dermatologist.
Oh, that's good.
That will start, she's preparing for her board exam.
Yeah.
Then she's starting in November,
Right.
after her exam.
Uh-huh. Yeah.
So how long have you been at the university as the dermatologist there?
Since 2006 as a faculty.
Yeah.
Yeah,
Wow.
when I passed boards.
Right. So Minnesota's really different from Brazil. and you've been to Brazil.
Yeah.
So Kelly and I have both lectured in Brazil, right?
That's so
Rio.
cool.
Yeah.
Rio, Sao Paulo.
You've been to
Yeah.
there already.
So yeah, it's really different.
It is.
It's cold.
Yes, it's much colder. I consider myself a survivor.
Yes, I like that
Because
attitude.
I come from a very hot and humid state in Brazil. And then getting here, I was like, am I gonna survive this? But I did, and now surprisingly, I'm more resistant to cold. When I go to Brazil, it's 50 degrees there, and people are wearing winter clothes, and I'm just like, that's not cold. So your reference changes, right?
Yeah.
But yeah, but Minnesota has beautiful weather,
It does.
like this time of the year, and then fall is just gorgeous, and you learn to appreciate the seasons.
Yeah, exactly.
Yeah, I hear that often from people who have like moved from like this south of the equator, right, to a place that actually has seasons.
Yeah, and we're both from Canada. So
Yeah, we're both from
we're
Canada.
used to the seasons.
So it takes a lot for us to feel cold, actually.
Susan lives in a place where I lived for a while that I've never seen such high snowbanks. So
Yeah.
Ottawa can be quite.
So interestingly enough, my husband was born in the Minneapolis area, and he went to vet school here, and he wanted to do a small animal internal medicine residency, and he got matched to the University of Guelph in Ontario, Canada, where I was a student in my final year. So that's how I met him.
Oh, that is a cool story.
I know. And my husband is one of those people that you will see in the winter wearing short sleeves. Yeah. I always say that in at least in Ontario, one of the first signs of spring is seeing somebody at Tim Hortons. It's a coffee shop, right? It's still winter, right? But they're wearing shorts and sandals.
Yeah.
That's the first sign of spring right there. Yeah, that's how you know.
And my son was born in Minnesota, so he tells me, I was like, honey, put a jacket on, put your sweater on. He's like, Mom, I'm not cold. I was born here. I'm not like you.
Yeah, I was born here. Yes. Yeah. That's great. It's a really nice story, right?
Yes,
right?
yes.
Veterinary medicine can lead you in some good places.
Yes, and then I met my husband, which is Minnesotan. So I came here to be to follow a career dream, and then I ended up finding the love of my life
And a family. And
I have a family, and now I'm stuck here.
That's the thing. So when you're teaching students, what year are they? Like, where are they in their?
So most of the time I'm doing clinical training.
Yeah.
So the
they
senior
do-
fourth year.
Yeah.
But I also teach first and second, sometimes third year.
Okay.
So I get all the levels.
Yeah.
Particularly now with being by myself.
Yeah.
Yeah.
That's
Yes.
tough, yeah. So
Yeah.
you're getting someone to add on. That's good.
Yeah.
So when you were talking about dermatology being a dream, can you kind of elaborate on how long did you know you wanted to be a veterinary dermatologist?
Yeah. And why dermatology?
That's a great question. So when I was in vet school, when I entered vet school in Brazil, it was a very large animal focused school.
Yeah.
And I had a mentorship in junior science projects, and it was in beef cattle reproduction. So for several years of vet school, until I started the clinical year, I was going to work with cattle.
Wow.
Reproduction. So I did
that too. That was my thing too, but dairy.
Dairy.
That's what I wanted to do.
But you actually did work.
I did it for 6 months.
So we have something in common.
Yeah, 6, 7, 8 months. Oh, yeah.
That's cool.
Yeah.
Yeah, and but then in my senior year, there was a guest speaker dermatologist, a professor from the University of Rio, actually. And I was actually organizing the conference with the other students, and she came and gave lectures, and I got to meet her, and she inspired me. So it took one person to really get the light, right?
Yeah.
And I was like, oh my gosh, the derm is so much more cooler than beef cattle reproduction.
Yes.
But so yeah.
Nice.
Yes.
It's interesting that you said it just took one person, because throughout the day, Kelly and I, in between episodes, have been talking about how slow it is to make change, and sometimes we, as like the roles we have in veterinary medicine, our leadership roles, we often feel like nothing has changed.
We're not making a difference.
Yeah, it feels like you can feel like you don't make a difference, but it just takes one person.
Yes.
That's good for us to hear.
That was you, in my case, right?
Yeah.
It just
She got me
takes-
onto cats.
I did.
So.
Yeah,
And
but that's a great way to.
Then that's inspired me, and I was studying English since I was 14. So I was like, I loved to get to know the American culture one day. So I came here as a student in 1998. Now you might start guessing my age, but I came as a student, and then I met this Brazilian mentor that I was following, and she was my second inspiration, and I say angel in my life. And I fell even more in love, and I was like, okay, this is what I want to do for the rest of my life. And then I got the opportunity to do my master's. But dermatology, there's something about those skin lesions. There's something about it, and the pattern recognition, right, that goes with it.
It's a lot of pattern recognition.
And you can see the lesions, and then you can tell so much about what is inside.
Well, you can. I for one struggle with that.
But it's I joke kind of that skin is the mirror of the soul, because you can't tell a lie. Of course, we need to investigate, right? We're not magicians, I wish, but it's just that the beauty of the patterns of the skin lesions, and also how we can impact quality of life.
Yeah.
Yeah.
Right? In dermatology, yes. And most of our patients don't die from skin disease.
But they may be miserable.
They're miserable, and their owners are miserable,
Yes.
right?
Yeah.
So when you see they come in and, well, first we're excited that we don't have skin lesions anymore, right? Because we are helping the patient. But then when clients are crying and thanking us for the impact that we made in their lives is what make me like so grateful to
very
be
powerful
in this career. And you guys know that feeling, right?
We do.
Yeah.
We do.
So-
It's just, for me, it's not with dermatology.
Yes.
You can't always be good at everything. So for me, it's sadly dermatology and ophthalmology. I'm like, for dermatology, I just have fleas, and for ophthalmology, I just have herpes virus. Yes, and then I'm done. So it's really interesting to hear dermatologists talk about their profession, because the ones that I've heard, like including you just now, have a very specific passion for dermatology, right? It's not like they were, it was surgery or it was something, or it's from the get-go, it's dermatology.
Yeah, and from the moment that I heard this person that inspired me, Dr. Regina Ramadinha from Brazil, she's a professor there, I was like, this is amazing. And I don't know, it's other passions can be contagious, and I hope I am also inspiring my students and my residents. When they come back to me and say, I want to be a dermatologist because of you, that's another awesome thing to hear, right?
That's great.
So
Is there enough veterinary dermatologists in the U.S., let's say, do you think?
it's a small college with
Yeah.
diplomats. It's growing. It used to be that I would go to the conference and we had very few people, and I knew everybody. And now, when I was a resident, right, and early in my career, and now I can't even recognize everybody. There's a lot of new diplomats,
Good.
which is a good thing,
Yeah.
right? And
Yeah.
we need more dermatologists.
Yeah, absolutely. Yeah. So it's good to know the college is growing.
Yes, it's very
Right.
exciting.
Yeah, because we've heard from talking with other dermatologists that often even vets aren't really well aware that they're actually a dermatologist they can consult, and certainly people like pet owners often don't know, right?
Yes, that's true. I joke. Pets have skin too, so they need a dermatologist.
Oh my gosh, that would make a great social media campaign. Pets have skin too. I love that. I love that. So, what is the most common feline dermatology problem you see, other than fleas?
Other than fleas. In Minnesota, we see fleas more on a seasonal basis and
Yes.
not as common. I
That's
think.
like us, I think.
Yeah, and
Yes.
probably general vets do a good job in taking care of that for us.
Yes.
I think they freeze in the winter time. The fleas.
Yeah. Yeah, sure.
In an apartment building.
They can still stay year round,
Yeah.
but in general, it's not the most driving problem that I
Yeah.
see. It's usually allergies, what we call now feline atopic syndrome or feline atopic skin syndrome, food, environmental
I have to
asthma.
learn to say that now, right? Feline atopic syndrome.
Or feline atopic skin syndrome.
Okay.
Because the atopic syndrome includes asthma, environmental, and food allergies.
Okay.
The atopic skin syndrome is just the food-induced cutaneous reactions, and then the environmental allergies.
Okay.
So FASS
Yeah.
or FAS.
Okay. So it's interesting that asthma is in there.
Yes.
Yeah.
And there is definitely a subset of patients that we see in derm that comes to us referred by an internist to
Right.
test for allergies.
Okay. So you will see a subset that have pulmonary disease
Yes.
and signs as well as skin.
Yes,
Right.
which then is more common. It's more similar to what we see in people, right? People react with respiratory allergies.
Yes. That's me right now.
Yeah,
Yes.
also skin, of course, but in people there's what we call atopic march, which is you have a progress of disease.
Okay.
That it can go from asthma to skin disease.
Oh, I see. I see.
And my son is atopic, My son had asthma. My son has skin it's
Wow.
itching, and so I've been trying to manage him along with dermatologists and allergists as well. But so similar to humans, cats have the respiratory allergies as well. Dogs not so much.
That's true, isn't it?
Yeah.
Yeah. The D species.
Sorry, I did say that, didn't I?
That's okay. You can say the lesser species. I say that often.
Well, I do have a close friend that is, and previous professor that he calls the feline species the superior species.
There you go.
So yes, let's talk about our superior species. They are little humans, but they're better than us. I wouldn't believe that.
Yeah.
So our cats do get some like unique things like skin lesions and lower airway disease. Are they closer to what happens in people than they are other veterinary species, or because cats always do their own thing?
I do think so, except that they're not as flexible. Humans are not as flexible as cats,
Yeah.
right? And
Okay.
dogs. And
Yeah.
in terms of itching, I think they just are able to reach different parts of their body
Right,
because
right,
of
right.
their
Right.
yoga mastering skills.
Yeah. But you
but
say cats get more sort of lower airway signs than canines do, and that's true in people too. I think, right? We get
Yes.
airway signs.
Yes.
Yeah.
So, and I think there are a lot of similarities with cats. Like
Right.
they also get more than dogs that middle ear infection after they have a cold, just like children.
Oh, really?
Yeah.
Yeah.
So they got a viral infection, Callice virus or herpes virus, and they have the upper respiratory tract. And because of the formation of the eustachian tube, or the way it's set up in the breed, in the species, you have a straight connection, much easier to get to the middle ear, and then they end up with otitis media. And sometimes it's even incidental, the finding.
Yeah.
After you're doing an MRI for something else. And by the way, they have otitis media, which has been there probably a while when they had the respiratory disease.
Oh my
They
gosh.
don't even have clinical signs.
Some do and can be really bad, right?
Yeah.
Neurologic
Yeah.
signs, but a lot of times can be incidental finding.
Yeah.
That is interesting. That's what I often forget that ear diseases fall into dermatology, right?
Yeah.
I tend to forget that. So
Yeah.
So you can see sometimes problems in the middle ear as well, right?
So do you often see also cats with inflammatory bowel because we then have food allergy, because we always look for those cutaneous signs as well? Do you handle some of those cases?
Yes, absolutely. We see those. And the challenge is to know, right, when they come in and they're having gastrointestinal signs and they're itching as well, do we know if they're related or not? Do we know if it's IBD or some other GI disease? And that can be hard without workup. But so we try to manage those cases. Let's say if you have your typical vomiting, diarrhea cat, right, with itching, and we try to manage that with diets.
Yeah. So those cats are more often food allergy?
Food allergy.
Yeah.
Well, there's a lot of IBD out there,
Yeah.
but if there is, so it could be two problems that are separate: IBD and food allergy,
Yeah.
skin food allergy, not
Yeah.
GI food
Yeah,
allergy, right?
yeah.
And we can also see. I think those cats that I have to refer to medicine, because yes, we do the food trial. Maybe they respond to the skin with the skin for
But
food
not
trial,
GI.
but not the GI. So then those cats I think have something else, right? And for the severe case, I also send to internal medicine to scope and biopsy and all that.
I've often heard that food responsive GI, so if you're changing a diet for those patients, if it's GI, they'll respond quicker than if it's like a more atopic.
Very good.
Is that true?
Yes, it's true.
It can take longer.
Yes, and
if it's not GI.
most of the cats improve towards within the first month
Right.
when they have food allergies, skin food allergies.
Right.
But if they were having diarrhea and vomiting,
Yeah.
then that can be the first improvement.
Yeah,
that we see that makes it more encouraging, right? But we have to do food trials longer because there is a subset of cats that will not respond until 8 weeks or even a little longer.
It's a long time for owners to.
Assuming they're on a strict diet.
Absolutely, it is a long time. I did food trial on my own, D.
How did that go?
It was hard.
Yeah.
I found myself giving him popcorn watching a movie, and my husband comes in and was like, wait, isn't that a food trial? What are you doing? And I'm like,
Back to day zero, you go.
so, right? And I knew he was on a food trial. I do recommend my owners to do food trial all the time, and there I am committing a crime.
I forgot.
And
It
it's
makes you more
hard.
empathetic to your caregivers.
Yes.
It does, I think, doesn't it?
You
Understand
feel
how
guilty.
difficult it is.
And food is love, right?
Such a connection.
Food is love. So
I
it's,
don't think people always realize how easy it is to. Like, we had one that had really bad food allergy years ago, and they had people over for dinner and didn't clean up the dishes, and they had made a ham, and the cat was allergic to pork and a number of other things. But they got up in the morning and her face was all scratched because she'd got
She, like, licked
ham
from-
in the sink. And people don't think about those
and
things.
if they're very
right?
allergic, a little bit of that protein
It
or that
can take much.
allergen
Yeah.
can
See,
be bad.
that's crazy. And earlier I heard Kelly, you say that you explain it to your clients similar to like a peanut allergy in people.
Yeah.
Right? That
Yes.
Because I think that's people understand that.
Yeah, I call
Yeah.
it the peanut allergy analogy.
That's
Oh, I
good.
like that.
They get that concept of the small bits. It doesn't take much for someone
Yes.
who's allergic to peanuts to have a severe reaction, even sometimes if it's in the
Yeah.
room,
Yeah.
right? And
Well, and
so-
there are some cats and dogs. I said dog again.
We're not
You should
joking.
count how many times I say that.
Yeah.
You'll we're off the rails.
I think we've stopped just keeping score. Actually.
Well, I'm not all animal lovers, I have to say. But so if we can see more severe allergic reactions that can be faster than your skin food allergist typical, like angioedema, right? The swelling
Oh,
of the
yes,
face,
yes.
difficult breathing. Those are life-threatening.
Yes.
Fortunately, we don't see a lot of those in in dermatology.
Yeah.
No, we don't love emergency.
Yeah.
Or cases that are dying on us.
Yeah.
So, but we do see sometimes cases that come for consultation from ER. This patient, it's swelling and
Yeah.
can't breathe.
Yeah.
What do you think is going on?
Yeah. So there are a few like actual derm emergencies.
Yes,
Yeah.
there are true derm emergencies. There are the not so true, not real, but emergency for the owners, right? Because
True.
maybe there's a chronic problem now that all of a sudden got really bad,
Right.
And for the owner, that's an emergency,
Right.
And then we have the true emergency cases that we need to intervene quick,
Okay.
or try to.
So that's a good point to end a little bit on that cliffhanger. So when you're back with us for the next episode, maybe we'll dig a little bit deeper into like the emergency part of it, because I don't think that's talked about very much.
That's true. That's
Yep.
true.
So that we'll start off with that in our next episode.
This is the Purr Podcast, where we talk cats, laugh a lot, and learn something new every episode. Together, we bring you the latest updates, surprising cases, expert interviews, and just a touch of chaos, because nothing with cats ever goes as planned.
So whether you're a seasoned veterinary pro, a new grad, or you're just here for the cat puns, you've come to the right place.